All right, greetings everyone. This is Eric Glazer, and welcome to our live recording of Bright Spots in Healthcare, produced by Shared Purpose Connect. We bring leaders together to not only inform all of you, but also, and most importantly, we unearth bright spots, successes at health plans, provider organizations, and other healthcare related companies around this country. Our goal is to identify as many bright spots as possible so that you, the listener, can determine if the ideas shared on our show are to be applied at your organization. We believe that this approach of finding a bright spot and cloning it is the most effective strategy to improving healthcare in our lifetime. If you have not already, if you're new to the show, I encourage you to subscribe to Bright Spots in Healthcare wherever you consume your podcasts. Every live webinar we do goes into our podcast feed within about 30 hours. You could learn about how healthcare organizations are investing in purpose. That's right, purpose as a strategy. You could learn about how health plans and provider organizations are innovating around health inequities and how to bridge that gap, how they're identifying silent sufferers around mental health, get some leading physician leaders talking about the future of primary care. I could go on and on the great topics and the exceptional leaders we've had on the show over the past couple of months, but they're all right there for you on your tablet or your phone if you subscribe to Bright Spots in Healthcare. Today's episode is compliments of our friends at Acario. If you've never heard of Acario, they are actually the newly formed company as a product of the merger between Novu Health and Revel Health. They provide a health action platform that unites pioneering technology, data science, and behavioral insights to connect everyone to better health. And you could check them out on their new website, icariohealth.com. I will spell that for you. Ario health.com. Now, these are my words coming up, not theirs, unsanctioned, but I do view them as one of the unicorns in healthcare because they actually combine innovation with pragmatic non-healthcare thinking. I'm going to repeat that, pragmatic non-healthcare thinking. And that allows you to drive better health outcomes for all the people you take care of or insure. And I'll tell you a little bit more about what I mean when I say pragmatic non-healthcare thinking later on in the show. We have a tremendous panel in front of you. I'm going to bypass reading their bios. We do not have time. We have so much to cover. In fact, PSA, we're probably going to go 5 minutes long today, maybe 3 minutes long. I apologize in advance, just an embarrassment of riches. We have great content scheduled for you. Sherry Keels, our producer, is going to post in our chat. If you've not already reviewed their bios or the emails we've sent, you could click on that link, get a sense of who you're about to hear from, the incredible experience and expertise you're about to gain knowledge from. I encourage you to check that out. Also, in 45 minutes or so, you're going to get yet another email from me. I know you're sick of me showing up in your inbox. This is our feedback form. Those of you new to the show, we drive our entire programming. We have grown this show over the last 7 years because of all of our listeners. We take their advice on the topics to cover, future guests to put on the show, and we also are able to meet folks who want to partner with us like Acario Health does, or the half dozen other chosen organizations who want to be part of our programming through sponsorship. And we do that all through the feedback form. It takes 2 to 3 minutes to complete. It's mostly multiple choice, really easy to do. And we invite you to take that. And if you don't, we're going to send you more emails. So please try to take that before you log off today and provide your insights on where we should go. Today's topic, today's episode is entitled How Health Plans Are Reinventing the Consumer Experience in 2021. Put another way, how are we all evolving to be truly consumer-centric? I meet so many healthcare leaders who say their organizations have become consumer-centric, but in truth, they're not. They still use patient too much. That's a physician term, by the way, not a consumer-centric term. And they're just not taking that truly empathetic approach to designing the experience an individual go through as they enter into a healthcare journey. So today, we've brought together these 4 leaders representing 4 great organizations, and they're going to share with you ideas around process and product that may inspire you to think differently or even confirm the direction you're going, and hopefully even and motivate you to go above and beyond what you're doing today around really, truly enhancing and optimizing the consumer experience. So welcome to all four of you. Really excited that you're here. I'll introduce your title and your organization as I bring you into the conversation. I know as an industry, we've evolved from population health. In fact, this show used to be called the Population Health Executive Roundtable. Our loyal followers know that. And we've now evolved as an industry into really thinking more about clinical and non-clinical determinants, those social determinants, to become more focused on the individual consumer. So I'm going to bring in Stacy Byers right now. She's the VP of Customer Experience at Highmark. Stacy, can you now explain how health plans can convert their competency from pop health to a more individualized, personalized based care? You are on mute, which will happen at least one more time with one of us. I guarantee you that. Cannot hear Stacy. Maybe it's on your end. I'm gonna shift over. I'm gonna bring in Steve Wigginton to take on this question next, and then Stacy will bring you in. Hopefully, we'll get your audio fixed. So, Steve, I'm gonna put you on the hot spot. How can health plans, with all the different organizations you're working with, and Steve is, by the way, the CEO of Acario Health and has worked with health plans all over the country, how are they effectively converting their pop health capabilities to individualized based care?
Well, first off, I want to say it's, I think Highmark appointing Stacy as the VP of Consumer Experience is probably a really good example of what health plans are doing, stepping outside all their own systems and processes and sort of claim system driven reality to appoint leaders that can help pull them forward and put the consumer, the human being first, and not call them members or patients, to your point. And I think you're seeing this cultural shift where this concept of an experience officer or a head of a consumer experience is taking root and really trying to pull these organizations further down the personalization spectrum. I think for us, just to speak briefly to that, when I look at population health, I have a long history in behavioral health, chronic care management, building population health functions within large provider groups. I think healthcare has a lot of goodness. I know that's not a really fancy term, but care navigation, care coordination, social determinants of health programs, transportation programs. There's a lot of goodness that health plans have created, but the uptake on that goodness is relatively low. And the challenge of communicating to an individual in a really unique and personalized way about how we as an industry can help them solve more of their health needs and their health problems it's a real challenge. And most health plans struggle to put that airlock between how I communicate with a human being and this programmatic goodness that they've developed across, again, across their population health, if you will, initiatives.
Could you provide an example of that, Steve?
Well, a great example would be in the DSNP population, the dual eligible special needs plan population. Many health plans see an opportunity there with the combination of Medicare and Medicaid reimbursement and the opportunity to expand the benefits set there to elevate the overall health status of the members in those programs. But those members are hard to reach, hard to communicate with, generally speaking, have been inundated with "we're here to help" type offers. And so there's again, sort of an airlock that can be created between how normal human beings that might occasionally pop into the 7-Eleven for most of their groceries take advantage of something that a very progressive health plan might be offering around social determinants of health.
And I remember when we were talking pre-production, Steve, you had mentioned this example about a patient named Joan, and then you talked about how you created a program that just engaged her, and I think you mentioned 3 pillars. So could you outline that? I want to go there so the audience hears that.
Yeah, I think, one of the things that's interesting for us is when a health plan has a real motivation to drive their members to do preventative screenings and things that are good for them. We have examples literally every day, but one that's top of mind I mentioned to you a couple of weeks back was, we have a member who we have reached out to and offered a gift card if she would go secure a breast cancer screening, which she was overdue to do. The health plan, of course, is motivated to make sure these screenings occur, not only for the benefit of the patient, but also it accrues to their stars and quality ratings. And a simple $25 gift card was just enough to motivate Joan to go get something done that I think she knew she needed to do. But the idea in her mind was, I'm going to give this $25 gift card to my grandson. And that motivated her to go get the screening. She identifies something early on, and that's much more treatable, as we all know, with proper preventative screening. So those kind of connections, maybe not intuitive to a health plan that thinks in a more population basis, but really drilling down to the specifics, those are the opportunities that we're trying to help them unlock.
Great. Stacy, do we have you back yet? No. I'm going to, sorry guys, excuse me, I'm going to play help desk for a second. Microphone bottom left, click on the caret, should put a menu up, maybe connect to audio, maybe you have to reconnect to your audio. I'm going to keep us moving on in our conversation. And I want to bring in some of our health plan folks to talk about examples. So I'm going to bring in Merrill Friedman. Merrill has a really cool title. So she is the Senior Director of Disability Policy Engagement at a little known company called Anthem. So Merrill, what are some examples of how health plans, AKA Anthem here, are innovating around the consumer experience?
Sure. Thank you, Eric. Great to be here with everybody today. A couple of things that we've got rolling on the technology front, which is probably where a lot of people are spending their time innovating. I always look at innovating, it's two things. It's one, it's, what's the new technology? What can we do? What grabs people's attention? But part of innovation also has to be very practical because people have to be able to use it. But a couple that we have going are our Sydney Care app, which helps people establish their own health profile, right? So you can download it on your phone, your iPad, whatever tablet you have. And we do help people get access to tablets if they need them. But really establishing your own health profile, right? What is that information that you need if you have chronic conditions, medications, any allergies, family histories, and your preferences, right? That's so incredibly important if we want people to really drive their own healthcare. What Sydney does then is it takes all this information and uses AI. And, my caveat here is we really do look to address those biases, those inherent biases in AI as well. I get over my skis pretty quickly on AI, so I'll kind of stop right there. But then Sydney will ask and prompt questions for you about the condition you've identified, like have you gotten your A1C checked if you have diabetes? Sometimes it may begin to detect that you have diabetes, even if you don't, by the information that you've put in. And then you can help redirect it, right? And it begins to store that information. Gets you really that access to those quick, easy, understandable, informational, panels that just list out health conditions that you can read about. If you need to find a network doc, sometimes you need to search, in 7 different ways to find the network doc, but it really helps you drive and manage your own healthcare, all right there in the palm of your hand. We also work with NoCD, which is an online app that I love, where people with OCD are matched with a licensed therapist who specializes in exposure and response prevention, ERP therapy. And it really is the most effective OC treatment that really is designed to help adjust triggers, decrease anxiety, and manage responses so people can get that help immediately. Also where they need it. And then Aunt Bertha is the last one I'll mention here because I know we're on a time schedule, which is just a really great database that you can search for. If you need, you can put your zip code in. You can access it from anywhere. You put your zip code in if you need help, if you're experiencing food insecurity and need to, get access to food, housing or homelessness. You can find places, shelters, right? You just get connected to everything. And then what we do is we work with our providers. And if our providers are doing a direct referral, we get that closed loop on the back end to know if people have followed up. So we can really then help them. And if they need help doing the follow-up themselves, then, we can jump in from a person-to-person response as well.
So Merrill, I think everyone heard of Aunt Bertha. If you haven't, you could certainly just Google in Aunt Bertha, STOH, it'll come up. I mean, I think the first thing that came up is a golf club, but if you just STOH, right. Sydney Care, is that a homemade or is that also third party?
Oh, there's a question I should have predicted. And I believe it's an Anthem app, but I'm going to plead the fifth on that one for now.
Okay. We'll have Sherry kind of do some digging behind the scenes. She'll put links up in the in the chat box, folks. Also, if you have questions for the panelists, I'll try to get them in. I told you we're tight on time, but definitely use the Q&A module. Don't use the chat. Much easier for us to manage it that way. All right, I'm gonna bring in Dodge, and then we're gonna bring in Stacy right behind him. Dodge, how are you guys over there at Bright Health Plan? And by the way, Mark Dodge goes by Dodge, by the way, is the AVP of Stars Risk and Quality at Bright Health Plan, which, as you guys know, is one of the leaders in sort of this trend of technology-enabled health plans. So Dodge, how are you guys? What's an example of how you guys are innovating around the consumer experience?
Yeah, thanks, Eric. So we are doing some innovation stuff, but I'm going to first talk about some basic block and tackling and then how we've pivoted to get some things better. So I'll give 3 examples. First is limiting the communications and trying to maximize our messaging. And I've seen a lot in my experience of either high achievers or leaders pushing for activity, volume versus impact. You know, what are you doing? How are we doing it? You know, push to get better results. That can be a trap that you can fall into that you need to be very careful of. So one, pulling that back, and I'll talk more about some of those pieces later on in this show. Second, on those communications, making it very personal. So again, from a STARS perspective, you'll see a lot of companies focusing on multiple gaps, calling members with 5 gaps, 6 gaps. We've pulled that back, and we're very specific to say, okay, we are targeting only for, say, breast cancer screening, get a mammography or get a colorectal cancer screening. By doing that, 1, it's simpler. And 2, you're able to weave in some of the CAPS components of, are you getting the care you need? Are you getting an appointment? And therefore you're kind of hitting 2 things, and it's much more fluid versus clunky. So, again, just kind of sticking to the old KISS rule, keep it simple, stupid. I'm not smart enough to figure it out. So sometimes simple is better. We also eliminated robocalls, IVRs. I know those are popular, especially with like med adherence reminder calls, but we've gotten pushed them all out. We're doing pretty much all live person calls. Again, it's a better experience. You can get more information, higher success, all that kind of good stuff. Nobody likes robocalls. I think a lot of people are doing this, and we are definitely pushing very heavy towards simplifying the language. Healthcare is obviously very complex. The information's, I've been at 20 years, I still get confused. Really pushing towards that 3rd grade level to make sure people understand it. And then finally, on the customer service side, really pushing for continual improvement. We review the call logs each week for where we've had maybe not clear or great answers or responses. So we look at those top reasons, top challenges, and then we retrain the entire customer service area to make sure that we continually are improving, refining, and trying to get that best experience from all aspects.
Great stuff. By the way, my favorite sports page in the days when we used to travel was the USA Today sports page. And my mother's a reading teacher, told me one of the reasons I like that is it's actually 3rd grade reading level. So don't judge me, everyone, but that's apparently a very effective way of communicating. I'm going to summarize what you just said, because I thought you said a lot of interesting things for the audience here. You limit the communications, which just seems counterintuitive, but you're limiting the communications to improve the overall experience. You're making it much more personal, which sounds like a big investment, but seems to be worth it for you guys, especially in your STARS ratings and your HEDIS scores. You're eliminating robocalls, which plays into limiting communications. You're focusing language at the 3rd grade level, which of course I love. And you're focusing on, as you're reviewing your calls and making sure that you're doing this in a good way, you're focusing on scores that tend to be a little bit lower and making sure that you have this information communicated and you're able to correct it with your call center. Did I catch all of those?
Yeah, well said. That was a great summary.
Okay, love it. Let's bring in now Stacy Byers. As I mentioned earlier, she's the VP of Customer Experience at Highmark. And could, as an example, Stacy, could you talk to me a little bit about how you're matching individuals with physicians? I'd love to hear more about that, if you could share that with the group.
Yeah, sure. Hi. So, I think one of the things that we've been thinking a lot about is how do we start to tap the emotional aspect of healthcare, right? So a lot of it is very transactional, very related to, kind of getting quality and accuracy. And we spent some time actually looking into how people feel about certain experiences. And so the tool that you mentioned is one we launched in late 2017 called Doctor Match. And that was really about doing more than what kind of a traditional health plan directory would do. So kind of taking it from, let's answer the typical questions about, is this doctor in my network? You know, is there parking? What are the hours? Are they taking the patients? And those kinds of things. And really starting to get at the fit and the connection that people have with their doctors. So we built a matching tool, a proprietary algorithm that actually looks at about 20 different factors of relationship between a PCP or an OB-GYN and that particular person who's seeking their care, so that they can think about how do they connect with that person on a more emotional level, because we believe that that connection with your PCP, for instance, is what will lead to better outcomes. That relationship that's built on trust is the one that is going to encourage you to do the things that your doctor says you want to do. So we're really looking at, you know, how do we deliver on some of those untapped or unmet emotional needs?
It's great. You know, I see a bunch of questions coming in. I've never done this before, and I didn't warn my panel of this, but here we go. So I'm talking to the four of you guys now. If you click on the Q&A panel and you see some of these questions coming in and you think you could answer them in writing, and you could choose, if you could choose to share them with the whole group, which I prefer, but if you have to send it privately, you could click on that send privately button. That would be great, because I don't think we're gonna have time to get through all of these great questions and stay on time with our plan here. So if you have, take a look when you're not answering, if you think you could handle some of those, like Dodge, there's a question about robocalls, which I thought would be right up your alley, and you could tee that up. Although I'm bringing you on stage right now, so not yet. I want to bring you back in. So how, as we've talked about some of these things around simplicity, how can health plans remove some of the additional friction so the consumer experience improves and outcomes improve?
Yeah, and I like that term friction, because that's really a great term of one of the things that we're trying to do. So around prior auths or authorizations, there's a couple things that we've done. One is we're trying to remove any prior auths where it makes sense. So I'll give two examples. Using breast cancer screening, for example, we know at the start of the year, there are a number of women that we're going to actively target to try to get mammographies for. So right out of the gate, we just remove all prior auths that would be needed for that population. Second, we looked at, excuse me, all prior authorizations that were going to expire in 2021. So they got the prior authorization in 2020. Looks like it's going to expire at some point in time this year. And we reviewed them to see, okay, can we just remove it? Are they stable on their medications? Is it deemed safer, you know, based on either new information or just reviewing it a second time? So we have a group of pharmacists to review that to say, okay, look, you know, Mark Dodge is on this has this chronic condition. He's on this drug. Why does he have to go through another hoop to, you know, get the authorization to, again, stay on that medication? So again, trying to minimize and reduce or remove those types of barriers for the members. We also extend prior authorizations. Typically, a lot of authorizations, I should say, work on a plan year where they stop on 12/31 versus operating on a 12-month timeframe. Again, minor, but again, if you can extend it and you don't, you know, somebody goes on and gets a prior authorization in November and then it stops 2 months later, it's just not a great experience. But if you can make it a 12-month period, just those little things can reduce some of that friction. And then the third one I'll mention around that as well is around rejects, medication rejections. So oftentimes, you know, you go get to the doctor, you might lose a dosage, you might have a dosage change, you might have to switch the medication. There's a variety of reasons why you have to kind of interrupt your standard refills for medication. So we've daily look at those and intervene and say, okay, you know, these should not be rejected. So we try to minimize any of the kind of interruption to the members' fills. Again, really focusing on reducing that friction and improving that member experience.
And as a consumer, I love those things. I love that. I wish my health plan would do that. I will not call my health plan out.
I wish it was my idea, but it was somebody else.
I love it.
I can't take credit.
Let's switch gears a little bit and talk about empowerment and what helps, how our health plans are empowering their consumers, their members to better manage their own healthcare needs. Stacy, could you come in now and could give an example maybe of how you guys are at Highmark are thinking about that?
Sure. And I guess, the thing that I would say about empowerment is that, it really goes back to how do I take the friction out of the system so that people have the time and space to think about health, right? So if you think about some of the challenges in healthcare, it's so administrative, right? As a person who's seeking healthcare, I'm stuck figuring out, is this doctor in my network? Can I even afford, the thing that I think I need? I'm waiting for appointments. I'm waiting on hold to get my questions answered. So there's like all of this kind of churn that actually I'm so focused on the administrative aspect that I don't have maybe the space and the energy, especially if I'm not feeling well, to take care of my health. And so a lot of what we're doing is just trying to open up that space so that people can think about health. One of the initiatives that we put in a couple of years ago was one around same day appointments. So if you think about, and this was for specialty care. So if you think about the waiting game that people have to play with specialty care, right? I call in, it might be months before I can get in to see a doctor. I don't feel well, right? I'm anxious about the outcomes. And so, we went in with a program where if you call by 11 in the morning, you can be seen that afternoon. And so, what that does is it takes some of that waiting, it takes some of that administrative hassle out of the process so that I can just very, very quickly take that next step toward getting well. And so, that's one of the things I think, like what Dodge said, changing prior authorization, trying to make some of those processes more seamless, especially for us, we're, a health payer and provider together. So we ought to be talking to each other and we've got to really start to streamline those processes. So we've done some work in that space to make improvements. And again, that just frees people to think about health, which is very much aligned to our mission.
Right. It's actually a good segue. I'm just, I told folks at the beginning of the show, I was going to tell everyone a little bit more about what I meant by pragmatic non-healthcare thinking. So for those of you who joined us a little bit late, today's episode is being brought to you by Acario, who's one of Bright Spots in Healthcare's longest and best partners. I just want to tell you a little bit more about them for a moment. They're a combination, by the way, of Revel and Novu Health. They combined just within the last 6 months, and they call themselves a health action company, and they deeply understand people by using behavioral research and data science to move people to take action for better health. I want to repeat that because this is where I'm going with my statement about pragmatic healthcare thinking. Deeply understand people's behavior through data and research to move people to take action. So they want to try to bring back sort of the humanity into healthcare communications by delivering a whole population solution, by reaching members that need healthcare interventions most, while at the same time driving low and moderate acuity members to action while with personal outreach at a scale. So this is what I meant. When you look at Madison Avenue and the approaches they take to driving all of our behaviors, they truly understand our consumer values. Even take the FANG stocks. They know exactly the types of products we use, and they deliver specific words and distribute those words to inspire all of us to make a behavior change, to make a purchase. So when you think about Apple and Tesla and Target and all those companies, they're driving all of us to do something they want. And although their words and advertising are different from all of your organizations, the principles are exactly the same. And if you want to move the needle in your population health and value-based care efforts, if you want to improve empowerment and engagement, whatever you just call it at your organization, you need to check these guys out at Acario, acariohealth.com. They know how to do this in a way that is non-traditional to healthcare, that really works in other areas. I encourage you to pick their brains for ideas. So I would encourage you to reach out to them. They have an interesting piece called The Quest for Member Satisfaction, why member satisfaction is both a priority and a puzzle for health plans. So that's usually you would have to sign up and do a registration form to get it. I'm going to have Sherry put up a poll right now. Anyone that wants a copy of that, I'll send it out to you, and it'll be a link with no front door to it. Just click on the link, it'll pop up the article, and you'll be able to review it and consume that information. It's fairly non-promotional, a lot of information there. So in a moment, Sherry, there's the poll that just popped up. So check them out, and in the feedback form that's going to be coming to you in just 15 minutes, if you want to meet them, I know a lot of them personally. I can tell you they're really smart, good peeps. They're willing to talk with you without signing a contract. And I will personally introduce you to them if you want. Guys like Steve, some of the executive team, Sarah Ratner, Ryan Schonecker, some of them, Sarah from some of the past shows. We'll get you in touch with them. You'll get talking to their team and you can learn a lot about what they're doing and how they may be able to help your organization. Okay. I'm going to transition back to the interview now. Steve, I'm going to bring you in. How can a lot of people are already asking questions about measurement. I see them here in the Q&A module. How can health plans measure which members they should engage and how they can best individualize their approach? What are you guys doing? What's your thought process in that?
Well, I think first off, thanks for the comments around our team, and I would exclude myself from all those favorable comments as I'm still chasing up the learning curve here on the specific expertise that our team has. But I think you're right. The measures, I think Dodge said it well, it's a bit of a shifting landscape. He mentioned caps in there somewhere. And so the measures that drive the financial performance, certainly in government programs, continue to evolve. And the challenges of balancing hardcore HEDIS measure improvement or med adherence improvement that are relatively straightforward, although typically not super well done in our view. Now you have to layer onto that the plus minus of the impact on caps. And I think, the idea of limiting makes a lot of sense to us. Targeting, being very specific about the message, the offer, the action, being narrow, being focused is a real hallmark of our strategy as we support health plans in these endeavors. I think the other thing that's interesting to us is we take the health plan's understanding of the individuals that they serve, AKA members, and we augment that through consumer data, hundreds of different data points that we bring into the personalization engine to prioritize message, offer, channel, frequency. I agree with Mark, or Dodge, sorry. I think most people would prefer not to get a robocall, although I have data that says for certain segments of the population, it's a preferred first choice of outreach, and then they would prefer to come back to you through your website. And so understanding all these channel nuances as a front end to the great work that Merrill and Stacy and others are doing, I think is really critical. The measurement piece, just to touch on that briefly, we know that there are measures that our health plan customers must improve to hit certain cut points or certain quality measure performance levels. We know there are other measures that they've got to progress forward, but they don't really have a shot to click over in the current year, measurement year, and others they're trying to maintain. And that's a part of the strategy formulation is really to bring personalization to bear, to extend the access to the goodness you're providing and drive those measures in a way that makes sense financially.
Great. Let me move over to the health plan folks and ask them how are you taking sort of some of the components that we've been talking about, some of the direction Steve mentioned that he has evidence to believe that certain market segments actually prefer a robocall. So how are you involving the consumer and how you guys are at least creating or at least testing your approaches to improving the consumer experience? And Merrill, why don't you go first?
Sure, happy to, thanks. So, I think, when we talk about what works best for people, the best way to find that out is to talk to the people who are accessing their healthcare, right? It seems so simple, but yet it's amazing how, often we can get tripped up, as large companies when we do that. But 2007, we developed a national advisory board that is comprised of people with disabilities, older adults, people who identify as LGBTQ, people are just different ethnic and racial backgrounds, right? To all say, help us, talk to us, look at our pictures. They couldn't even believe some of the pictures and messaging we were using back then, right? But we said, come to the table, talk to us about this. Help us make this, because it's the old, if you see it, you can be it. Do I want to, does that inspire me? That picture inspire me to create change? Are you thinking about access for everybody? Are you being, aware and culturally competent when you're looking at solutions to close care gaps for people experiencing homelessness, right? Does this all make sense to me? Is this really you may think this is good for me, but as a person with a disability, is it really accessible to me? Is it respectful to me? So we brought them in and they are still with us. I still lead that board to this day. It's convened by Lex Friedman, one of the architects of the Americans with Disabilities Act, and it is a driving force in how we think and what we do. We also collaborate with people. You've heard a lot about third grade language. We work to partner with like the Autistic Self-Advocacy Network and other disability organizations to say, are we speaking in plain language? I mean, you can take it to the other extreme, like, I don't even understand half the EOBs and things that, we send out to people, but are we speaking in plain language? Are we being transparent? Are we giving people the opportunity to really understand and engage in their healthcare? And the way that you do that is you work with them to make it understandable. So real strong focus on that. Listening sessions, not focus groups, not architected focus groups, not groups of PowerPoints, but truly sit in a room with all different kinds of people in their homes and communities and listen to people. Their feedback is amazing and make it actionable. So taking feedback from people and doing nothing with it isn't as helpful as taking feedback and really creating actionable change.
Hey, Merrill, are you using a third party for that, or do you guys go out in the field? How do you execute on that?
No, so I lead our advocacy at our team. So we do a lot of that. We have some, a lot of colleagues in our stakeholder outreach, but no, we do it personally. It's all person to person. And it's really, and then we ask people like, who should we be talking to? Like if you're talking to somebody, like somebody would if they were in marketing, I guess, or something else, right? Who else should we be talking to? Who's had an experience? Especially people who have had crummy experiences, right? They give really great advice on how to make experiences better for people.
Yeah, I love it. I mean, there's this saying, forget who I heard interviewing, maybe it was Matthew McConaughey, and he said one of the most inspiring things his father ever said to him is, if you're going to do something, don't half-ass it. And it sounds like when Anthem, I mean, what you're explaining isn't rocket science, but it takes a lot of effort, but you're certainly not half-assing it. I would encourage everyone to have that same mindset for sure. Stacy, Highmark, what are you guys doing around getting folks involved, and how are you thinking about improving the consumer experience?
Yeah, so we've spent a lot of our time over the last 2 years, particularly in the marketing organization, looking at simplicity, right? So totally redefining our brand standards, our tone, our voice, our illustration style, all of that, our photography style, to really meet the hallmarks of simplicity. And so, develop that standard, started in one market segment to test it, to see like, how does comprehension change? Are we actually getting through to people in a way that we thought we would with these transformed materials? And when we proved in the small market segment that they were actually more understandable, right? That they were meeting people's expectations around being simple and actionable, then we moved those programs out to broader markets. We've also been measured by the Siegel and Gale Simplicity Index for the last couple of years. And so we started, again, with this marketing effort, and we wanted to increase our ranking on Siegel and Gale. And so very, intentionally went after those qualities. And we've moved up. We're actually now top in both industries, on the Allegheny Health Network side and on the Highmark side, both payer and provider. We're top in simplicity according to Siegel and Gale. So, it was kind of a long journey, and just one with marketing materials, but that's the place to start, right? So now we can say, hey, we've proven that we've made things more simple just with marketing. What can we do as we think about extending that out to things like operations, right? So how do we start to change some of those operational letters that give consumers challenges? So I think that's important for measurement. And the other thing, we have done a lot with plain language. We've won some plain language awards. We work with the Center for Plain Language and have entered a number of times to, again, measure the comprehension, the readability, the understandability of the pieces that we are sending out to market.
Great. Love hearing these things. Let's talk about incentives. I'm going to bring in Steve for that. Steve, how are organizations incorporating rewards and incentives into their overall engagement, empowerment efforts, and providing a better experience?
Yeah, I mean, we see a real diversity of application. I think historically, rewards and incentives might have been viewed as something you did when you were in a bit of a hole and you needed to move a measure in short order in order to hit a cut point or achieve some level of quality payment. And what we've seen over the last 18 months, and particularly over the last 12 months, is a real holistic view of rewards and incentives as a part of, I think, as Dodge mentioned, this sort of the caps overhang here, where the rules have changed, the weighting has changed, the importance on your ability to support your mission, is really tied to this much more difficult to manage area of satisfaction and experience. And I thought Stacy's comment was interesting. You sort of work your way through, and eventually you get to operations and compliance and these different functions inside the health plans that, I think are complex and inside out historically. And I think all of our panelists here are trying to take an outside in view, plain language, understand our audience, do research, et cetera. But we've seen a real uptick in the use of rewards and incentives to drive the kinds of behaviors that both we and our health plan clients see as critically important. It's not as simple as it may sound, and we see a lot of people doing it poorly. So I get a claims feed, it shows you got a colonoscopy, I reward you with some kind of a coupon or a gift card. That's after the fact. You're not incenting behavior, you're not focusing those resources. So our real focus is to help people understand, help our clients understand, what are you trying to achieve? How do you most tailor those incentives for the people where you can have the most impact and drive measures that are sustainable? And by sustainable, you have to be able to make an ROI case inside of a health plan that the investments you're making, for example, to get someone to get a colonoscopy, which might be a higher dollar number than a breast cancer screening or an annual wellness visit, but may be critically important for that member's health outcomes and your own star ratings. So we see a lot of shift, I'd say, over the last, like I said, 12 months. COVID's really brought this to light as well. So there's 80 new CMS measures or screenings that you can do virtually. So how do you get trial on virtual healthcare? How do you get trial on mental health care? Could you offer a reward or an incentive, a gift card, to get somebody to get through that initial trial that then gives them greater access, higher satisfaction? So it's been fun to try to adapt a proven platform to a new set of challenges.
It's a good segue into virtual. I know a lot of you are asking about impact and measurement. We're going to get to it. I have those questions ready. I know some people are also asking about how do you get to that third grade reading level and how you execute on that. I'll try to get that towards the end here as well. As far as virtual engagement goes, Stacy, how are you guys thinking about virtual and the overall strategy for your consumer experience?
Yeah, so I think it's really interesting, right? Everybody saw the massive spike in virtual care with the pandemic. And I think it's really easy, in the health plan, especially, to say, I just want to see more of that. This is great. Let's just keep it going. And I think what we're really trying to do is focus on context and how can we learn from the context that drove that high utilization. So, when we looked at people's experience in virtual care right at the start of the pandemic, we found that 75% of the people scheduled their virtual visit because their doctor's office reached out to them. So they reached out, they said, hey, you were supposed to come in to see us next week. We're going to do that virtually. Here's how you do that. They had people to do tech support to walk them through the process, right? You have the context of the virtual visit is now free, whereas they might have had to pay when they were going in person. So you've got all these things that are kind of contributing to removing some of the barriers of virtual care that maybe people had historically either perceived or experienced. And so I think that's an important part, because you cannot keep that same kind of utilization if the context isn't exactly the same. So if there's a point where now I have to pay for that virtual visit, I'm going to be looking at value, right? Okay, I'm not scared to leave my house anymore. There's nobody reaching out to me and setting this virtual visit up for me. I like talking to my doctor. There's parking at the office. It's not that much more expensive. Maybe I should just go in. Or the value I perceive of going in and having my doctor eye to eye is different than the value of us having some sort of virtual connection. I think we also know they want to see their own doctors, right? That was the thing that worked out really well with the pandemic. It was their own doctors' offices reaching out and saying, you'll see me this way. versus a lot of the telemedicine capabilities that had you waiting in line for, a visit with some unknown person. So again, we have to really start to look at what's the context and how do we make sure we're removing the barriers and understanding the value prop for those consumers.
Just another reminder, folks, in about a minute, if not now, another email in your inbox, provide us some feedback and where we should go next as our programming evolves to 2021. Thank you in advance. Dodge, what about you guys? You're technology enabled, cutting edge when it comes to just using technology to create a health plan. How are you guys thinking about virtual care as a way of improving the consumer experience?
Yeah, I mean, obviously, everything that Stacy said, I agree with a lot of those points. The accessibility is fantastic. From a risk perspective, I believe we get one new HCC code for every 4 or 5 visits, so that works out fairly well. But we did see some challenges also from a STARS or gap in care perspective. We found minimal lift. It's very hard to get gaps closed via telehealth, which isn't surprising because you're not right there to address a certain gap or prevent a screening in the office, and you're either sending a test kit or sending something to them, and it's just not quite as impactful. But more importantly, perhaps, is based on a survey that we just did through a third party. All of our markets listed ease of telehealth as a problem, and we're looking into that more. But there seems to be some general challenges, and I want to make sure I get them right, so I'm going to the notes. One is difficulty finding the telehealth on the provider webpage, limited appointment times. The specialist, going somewhere outside of the provider doesn't offer it. Technical problems, poor connection, what have you. And then sometimes there was a no-show or a change in appointment or something got lost in communication between the parties. So there were those problems that seem to be, I guess, consistent in the markets. And I don't know if this factored into it or not, but language barriers and health literacy factors also could be contributing factors. So again, there were some challenges just that we have within that. Again, it's a wonderful service, especially in the environment that we're in. But do we want to acknowledge that? We are trying to obviously resolve some of that. I think I can't remember who mentioned it. Merrill, I think it was you, but giving members tablets to try to make that part easier, where it's like basically one button or one app, click, straight to it to help minimize some of that. A lot of education, both for internal to our customer service team to say, hey, you might get inquiries about this. Here's how to help the member. Also pushing information to the members to say, if you're going to go down, use telehealth, like a tip sheet. Again, trying to help bridge that gap. But we're also promoting more in-home assessments versus telehealth. Going back to what I started with on the value piece of it, it's great for access, and I wouldn't want to take that away from anybody by any means. But if they have both options and they're open to doing an in-home assessment, the experience seems to be better. You're still getting the HCC or risk benefit, but you're also now going to get a higher, or at least what we've seen, is more gaps closed from a STARS perspective. So you're winning on multiple fronts. So we've started pushing a little bit more towards in-home assessments.
Great. And I don't know, Dodge, I apologize if you mentioned this already, just to give people a level set. You're exclusively talking about your MA population or your Medicare population.
Yeah, I should. Yeah, absolutely. I am talking about MA.
Got it. Awesome. Yeah, that's really good commentary. I'm going to get into now. Let's talk about ROI and impacting the bottom line here. How does consumer experience impact the bottom line of your business? Steve, how are you looking at it for your clients?
Well, it's fundamental, particularly in, I'd say almost all of our clients are focused in Medicare or managed Medicaid. And so those programs are all metrics bound to ensure health quality outcomes. And those metrics are increasingly, as we all know, I think everybody on this podcast probably knows, are heavily weighted now towards the experience caps, the satisfaction of the member. And unfortunately, more and more of those variables are outside the control of the plan. what was their experience with the provider? What was the appointment availability? I thought Stacy's example of sort of the same day thing is like perfect. Of course, you got to go contract that, with your network and create that space. Things like home health visits that Dodge mentioned, the virtual care that we've been talking about, creating uptake on that so that people feel it's easier to take advantage of their health plan membership. Those are critical. And, the math is fairly straightforward. A STARS rating that's driven by HEDIS, med adherence, and CAHPS scores. We, with our clients, often draw programs designs based on how much should we invest to get the results we need to get to continue to pursue our mission. And so it's like any other program or initiative that any of our panelists would be launching. You've got to be able to demonstrate that it supports the sustainability of your mission. And that's critical in MA, as we know. We're seeing an increasing importance in managed Medicaid. It's an area for Acario that we have a deep mission-oriented sense around wanting to make a difference there, despite the challenges of working across many different state metrics areas. But that's the one advantage I think all of us have that are trying to drive a better experience for human beings and allow them to tap into the goodness of healthcare, is that there are measures that reflect that goodness, that sustain those investments as we try to pursue our mission.
Stacy, how are you looking at it with your organization?
Yeah, so I think for us, there's always been a lot of effort toward what's the business value of the thing we're doing and how feasible is it. One of the big cultural changes we're really starting to make, though, is kind of to think about that as a Venn diagram, that it's like what's the business value, what's the consumer value, and what's the feasibility of the thing that we're going to do. So because you can't just go after only consumer value, right? Because that might be then unaffordable. It would create scenarios that are simply not sustainable. So I think if you look at all three together, that actually can transform the experience. And so one of the things that we've historically been challenged with is really understanding that consumer piece of the puzzle when we're teeing up, for instance, our strategic planning. So one example of a thing that we changed in the last couple of years was to add a consumer experience workshop step to any of our strategic planning. We were already really good at looking at kind of the business expectations of a capability, but when you did that without the consumer lens, you might go develop something that didn't get adopted as widely as you had hoped it would. And so by kind of layering on the consumer experience component, we were able to first make sure that those initiatives were going to be pointed at the right things, that they considered what components of the consumer experience would add cost to an initiative, right? So like if you didn't contemplate that you've got to go totally transform the way ID cards are distributed because you just wanted to save money by making everybody have a digital ID card, you have to really think through the consumer part of that experience to get the value out of the investment. And we ended up saving a lot of money. We were solutioning some projects that didn't have a consumer experience perspective, and therefore then down the line, they cost more than we anticipated because we hadn't covered that step. So part of our process is really about how do we start to transform the steps in our planning process to account for the consumer needs so that we get a much fuller picture of how consumers might adopt the things that we're developing.
That's good. So Merrill, as you have the outcomes that you need to reach, you have this effort to reach them. How is your executive team, how is the culture at Anthem enabling all of you to not only promote these positive outcomes and get there, but also keep the staff focused on client centricity?
Sure. Well, they tolerate me being everywhere I can. Talk about, but I mean, it's so socialized within Anthem. You really have to get it into the DNA of everybody, right? Whether it's an actuary or, a CEO or a service coordinator, everybody has to understand that this is all about people and people's experience. That's what it is. It's about people's ability to access their healthcare in a seamless way that's culturally competent, that's respectful, that's accessible, that's understandable, all the things that we want from healthcare. So, we do a couple of things. One is, we have weekly conversations on culture, even just among our staff, right? Developing all of those awareness, pain points and the tools, right? And then work to deploy them. So we have these practices that we do where we're talking through, interactions, people's feelings, and really just trying to continue to humanize it. How do people perceive us? Are we assuming positive intent? I'd say that's probably the hardest one most often, for people, when people are asking questions, assume positive intent, and your answer is much more balanced and much more engaging and much more centered on the people that we're working and talking about, right? We use person first language in all of our materials and all of our speaking. This is all about people, right? It's not about labels and populations. You've already said, how do you take, population, to individual? Well, we start talking about people. We are, in our government business division, a person-centered organization. So people have been trained at all levels of the organization on person-centered planning, person-centered thinking, right? And what we call person-centeredness, and that ownership of your healthcare by the person whose healthcare it is. And so through all of these trainings and culture conversations and talking, right, we embed it in our DNA, right? It's what you do when you get here. And it drives to the ROI, the prior question that you asked. I mean, I remember my first boss in managed care, because I came from owning and operating, on the provider side. And he was like, no margin, no mission. And it took me a while to connect those dots, right? To really, what does that mean, right? It is our mission. It's by doing good that we do well financially. And those are the buzzwords you can put to it. Stacy spoke so articulately to it already, so I know we're on a time crunch. I'm just going to kind of ride her coattail on that. But it does make sense when people are happy with their health care, right? You get better outcomes, both for the person, priority, and for the company.
So simple, yet so complex. When people are happy, you'll get better outcomes. It's brilliant. I'm going to circle back to some outlying issues that we've had during our discussion. And one of them has come up from a number of listeners is, how do you get to that simplicity in communication, whether it be written or verbal communications at, what I think Dodge said as a third grade level earlier on the show. How are you guys getting there? I don't know, Dodge, if you want to tackle that, or anyone can jump in.
Yeah, I'll start. And I definitely want to say, that it's not easy, and not every communication is going to hit that mark. I was actually just talking to our marketing team, and currently we average a fifth grade level. So I do want to make that correction. I think I got third grade stuck in my head from a prior conversation, Eric, you and I had about USA Today. But regardless, fifth grade is still fantastic. So what we've done, we brought in experts from outside, and obviously hired them. But some of these people didn't have any healthcare background, so they have obviously a skill of writing at a level that anybody can understand at a fifth grade level or better. But they didn't have the healthcare background, and what helps is they're coming at it from the member, so they haven't been indoctrinated with all these different terms about caps and stars and whatever. So they really can break it down much more effective than somebody perhaps who does have a healthcare background, which again might sound a little bit counterintuitive.
Yeah, Eric, I just chime in there. I mean, we have a team of 25 people who do nothing but research and content design. And exactly down the vector Dodge was just describing, the best way to understand how to speak to a DSNP population, or to Merrill's domain around, disabled populations, or folks that are accessing the healthcare system from a very unique point of view, is to go speak with them. And they don't know the term SDOH. They know I don't have a grocery store within 6 miles of my house, and I don't have a car. They know that. And so there's work we think is really important that we've funded on behalf of our clients to say, let's go out in the field, let's sit down with these people. Because the inside out view from healthcare, it's one of the most complex industries, most regulated, for the innovators on this panel, one of the most challenging industries in which to operate. The best thing to do is go outside in.
I 100% agree. I mean, there's really no other way to do it. You've got to get rid of all the buzzwords, all the jargon, and really speak to people and have those hard conversations. And we can't do that inside of our walls, because it's not as effective. So Dodge and Steve have covered it, but the reality is Get people engaged in what they understand and how they perceive this, and they will help you speak more clearly and transparently with the people out there. 100%. And don't focus so much on grade level, except sometimes we're required to in our bids. Like, I get that, but it is that plain language, right?
Yeah.
That's such a key term here. Plain language, easy read for everybody.
That's great. Also, we had an issue with the email, the survey going out. We just posted it in the chat. I'm pointing to my other screen. So take a look at that. Maybe give us a couple of minutes of your feedback. I really want to thank all of you. This was super awesome. Where could people find you? We're getting questions around, hey, how could we get in touch with these folks? You're all on LinkedIn, right?
Yep.
All right.
Right.
Look them up on LinkedIn. It's this website, linkedin.com. Just cooking. And check them and reach out to them with any follow-up questions you may have if you want to reach out to any of these folks. Thank you again for all the prep, all the time today. Thank you all for taking an hour of your day. We do not take that lightly. We feel like we want to make sure we get the privilege of earning that back each and every show. So thank you all for showing up and listening. This will mark the end of the show. This will go into the podcast feed in about, we'll call it 30 hours, maybe a little bit less, but we'll call it 30 hours. Thanks, everyone. Panel, why don't you stick around for a second?